All right, let's jump right in. We're looking at two areas of American healthcare that, let's be honest, don't always get the spotlight: hospice care and rural health. But right now, both are on the verge of a massive nationwide overhaul. And what's driving it? Well, it's a huge $50 billion bet being placed by the federal government. So here's how we're going to break this down. First, we'll look at that massive $50 billion bet on rural health. Then, we'll try to untangle the messy policy puzzle that comes with it. From there, we'll get into the real-world hurdles providers are facing, and finally, ask the big question: what is next for end-of-life care in America? Everything really kicks off with this number: $50 billion. I mean, this isn't just a small funding boost. It's the kind of money that is meant to fundamentally reshape huge parts of our healthcare system. And that really is the big question, isn't it? What in the world happens when you inject that kind of cash into the system? Let's take a look at the actual plan. Okay, so where is all this money going? Well, it's all tied to a single landmark federal program. Think of it as a massive bet on revitalizing healthcare outside of our big cities. It's officially called the Rural Health Transformation Program. It's being run by the Centers for Medicare and Medicare Services, you'll hear them called CMS, and its main goal is pretty straightforward: to build up and strengthen healthcare for the millions of people living in rural America. But the money doesn't just go straight to doctors and hospitals. See, the way it works is CMS first opens up applications for state governments. Then the states have to apply by November 5th deadline. The ones who win those grants get to decide how to distribute the funds to their local partners, which lets them tailor the spending to what they actually need. So what does CMS hope to get for its $50 billion? Well, their priorities are pretty clear. They want to improve overall health, make sure people can actually get to a doctor, build up the healthcare workforce, and really push for new, innovative ways of doing things, especially with technology. It's a big vision. But here's the catch: this $50 billion isn't just appearing out of nowhere into a nice, clean system. Nope, it's landing right in the middle of a really complex, shifting policy puzzle. And believe me, it is about way more than just the money. Just to give you an idea of how crowded things are, just look at the calendar for fall 2025. You've got a new hospice payment rule kicking in on October 1st. Then, just a few weeks later, that huge rural health grant application is due. For providers on the ground, it's just this whirlwind of overlapping, high-stakes deadlines. And as if that wasn't enough, at the very same time, the U.S. Senate is debating the Supporting Our Seniors Act. So you've got this major action from CMS, and at the same time, major action from Congress, all focused on long-term care. It's a lot. All this overlap creates some real friction. Take the new HOPE tool, for example. It's this new mandatory data requirement from CMS. But providers are saying, whoa, hold on, we need a delay. And CMS is basically pushing forward anyway. You can imagine the uncertainty that creates for people trying to run a hospice. So let's talk about what all this policy chaos actually means for the providers. You know, the people on the ground who have to make all of this work day in and day out. It's creating some very real hurdles. In fact, when it comes to that HOPE tool, one industry report described the situation as CMS on radio silence. And that feeling that there's a huge communication gap between the regulators and the people doing the work, it causes a ton of stress and makes it almost impossible to plan for the future. And that uncertainty, it has real-world consequences. Take telehealth. A lot of hospices know it could be a game changer, but they're holding off on making big investments. And why wouldn't they? Why spend millions of dollars on a new system when the rules of the game could completely change next year? At the same time, the financial and legal stakes are getting way higher. We're seeing a really clear link now between poor quality of care reports and a much higher risk of getting sued for false claims. So providing poor quality care isn't just a clinical problem anymore, it's a massive legal liability. But honestly, the risks go so much deeper than just lawsuits. When you get to the most severe end of the spectrum, you're talking about the absolute fundamentals, patient safety, and whether you can trust your own workforce. And nothing brings us home more than this really shocking case out of New Mexico. A woman was actually indicted by a grand jury for pretending to be a nurse. And in doing so, she put a patient's life in serious danger. It's just a chilling reminder that checking credentials isn't just paperwork, it's a life or death issue. The state nursing board is now begging employers to be more diligent. So, where does all of this leave us? I mean, what does the future of hospice and rural healthcare actually look like when you have this enormous pile of cash colliding with these incredibly deep-seated challenges on the ground? I think it really comes down to a system that's just full of tension. You've got the incredible promise of a $50 billion investment on one side. But on the other, you have this confusing mess of policy and some really scary risks on the ground. Everything from regulatory silence to, well, fake nurses. Which leaves us with the one question that really matters. With so much money and so much potential, but also so many pitfalls, is this historic investment going to lead to a real, lasting transformation? Or is it just going to be a temporary fix for a system with much, much deeper problems?